Congressman, you're convoluting different things into one.
That's not a convolution.
Yes, you are.
If you contract with nurses, and I have hospitals in my district that can't find nurses because they're losing contracted nurses to Texas or Arizona, that's not a conflict. That's not a conflict. There's a pool of people who have an ability to work. So how many nurses have been contracted with by HHS?
So, Congressman, again, you have to distinguish between the licensed care facilities and the emergency intake sites that we operate.
In the emergency intake sites, how many nurses has HHS contracted?
I can try to get you any numbers we have, but because they are emergency intake sites, and this is important, we don't provide the same level of services that you get in a licensed care facility. By being a licensed care facility, they have some of those licensed professionals there providing services.
How many licensed care facilities does HHS currently have dealing with the illegal immigrant issue caused by the Biden administration?
I want to make sure I don't misspeak, but it is at least dozens, if not hundreds.
How in the world are we building out facilities for illegal immigrant children while our own foster care system is collapsing under the weight of neglect? We've got American kids sleeping in offices because there aren't enough homes. We've got hospitals begging for nurses. We've got communities stretched thin. And somehow, magically, there's money, buses, contracts, and staffing ready to go when it comes to processing border surges? Children applying for asylum? Hold on. Watch a Republican congressman do what nobody in this administration seems willing to do. Ask basic, straight-up questions. How many kids? How many facilities? How many nurses? How many buses? And what did he get in return? Fog, word salad, and a lecture on characterization. This wasn't oversight, it was an exposure. If you're tired of bureaucrats dodging while the border explodes, hit like, subscribe, and stay right here. Let's watch the full clip before I give you the full breakdown.
Thank you, Mr. Chairman. Mr. Secretary, thanks for coming in. Let's hop to it. Got a lot of stuff. Back in February of 2021, how many children did your department take possession of from Homeland Security because of the surge of illegal immigrants at the border under the Biden administration?
Congressman, I don't have that number before me, but I can get that to you.
All right, so let me ask you the second question. In response to what was happening at the border back in February 2021, it was the position of your agency, your department, to go through the process of setting up tent facilities at Fort Bliss and other facilities across the country. How many facilities does HHS currently have in operation that houses illegal immigrant children in the United States?
So, Congressman, right now we have a number of the unaccompanied migrant children who are applying for asylum and therefore have a basis under our laws to be here while they go through their process. We have a number of facilities. There are scores of facilities that are what we call licensed care facilities that have the license in the state where they are residing to offer care. There are scores of them throughout the country that we use. Most of the care there.
How many? So I've seen some of your facilities. I've toured a couple of them. Unbeknownst to staff, I just kind of showed up. You know, that's the purview you kind of have.
Are they the licensed care or are they the emergency?
No, these were the facilities at Fort Bliss. When they were still setting up Fort Bliss, I walked on the base and saw some of the facilities.
Right.
I also saw, if you're in that section, that it appears to me that HHS has contracts with various hotels throughout the United States that would house young migrant children in hotel facilities, where it seems like HHS would contract for the hotels and they would cover up the marquee, and we were housing young children. Do you happen to know how many hotels that HHS currently has under contract holding migrant children?
There are no hotels under contract.
Not anymore?
There are no kids in hotels.
You sure about that?
Unless you know something I don't.
I've seen the facilities. You sure?
You name me a hotel.
Okay, well, the marquee is covered up, sir, under contract for HHS.
Let's
move on. In the facilities that you have where you hold children, how many nurses has HHS contracted with to actually provide health care to children who are being housed by HHS? And how many of these nurses have been relocated from hospitals throughout the pandemic where they could have worked in our hospitals with respect to COVID-19, but they were actually being contracted with by HHS?
Congressman, you're convoluting different things into one.
That's not a convolution.
Yes, you are.
If you contract with nurses, and I have hospitals in my district that can't find nurses because they're losing contracted nurses to Texas or Arizona, that's not a conflict. That's not a conflict. There's a pool of people who have an ability to work. So how many nurses have been contracted with by HHS?
So, Congressman, again, you have to distinguish between the licensed care facilities and the emergency intake sites that we operate.
In the emergency intake sites, how many nurses has HHS contracted?
I can try to get you any numbers we have, but because they are emergency intake sites, and this is important, we don't provide the same level of services that you get in a licensed care facility. By being a licensed care facility, they have some of those licensed professionals there providing services.
How many licensed care facilities does HHS currently have dealing with the illegal immigrant issue caused by the Biden administration?
I want to make sure I don't misspeak, but it is at least dozens, if not hundreds.
Okay, question. How many teachers currently are contracted with by HHS? Because in one of the facilities, there was actually education being going on, and there is a contract associated with that. How many teachers are contracted?
Again, are you speaking licensed care facilities?
These are the emergency care facilities.
I'd have to get you that number because, again, we're not obligated to provide educational services at these emergency intake sites.
Okay, real quick. I know sometimes these hearings, it seems like we're going back and forth, but that's because we have a limited amount of time, a lot to get to. Quick question. When I was at one of the Border Patrol facilities, I believe it was down by Fort Bliss, El Paso section, there are buses and there are motor coaches that were coming and picking up children 15 at a time, 20 at a time, 30 at a time. How many buses has HHS contracted to move illegal immigrant children across the United States away from holding facilities by the Department of Homeland Security?
So, Congressman, I would ask you to make sure that your reference is accurate. These kids have requested asylum, whether or not
it's regardless of their asylum question, is how much has HHS contracted with to move children across the United States?
But their presence here is not as you categorize it because they have requested asylum, and therefore it is an unfair characterization.
Did they request asylum at the southern border at an illegal point of entry, yes or no? Is the southern border an illegal point of entry for immigration purposes, yes or no?
When you are requesting asylum, you are conveying that you are trying to escape persecution.
All right, real quick, 15 seconds. Last question, Mr. Secretary. Title 42 is about to be undone by the administration. Does your budget account for a surge of new migrants, illegal immigrants, however you want to phrase it, that are going to come to the southern border and request asylum under the most broad interpretation of asylum in American history? Is HHS prepared in the current budget to deal with the massive increase of people that are going to come to the United States, including illegal immigrant children?
We appreciate the work that Congress has done to provide us resources to try to provide the legally obligated services for these unaccompanied migrant children. We're going to do the best we can with the resources that we have.
Gentleman's time has expired. I now recognize the gentlewoman from the Virgin Islands, Ms. Plaskett, for 5 minutes.
Thank you very much, Mr. Chairman, for holding this hearing. I want to thank you.
That exchange was brutal, and it should have been. The Republican congressman asked simple, measurable, adult questions. Numbers, contracts, facilities, staffing, logistics, the kind of questions you'd expect any department head to answer without breaking a sweat. Instead, we got deflection after deflection. How many children? No number. How many facilities? Maybe dozens, maybe hundreds. How many nurses? I'll get back to you. How many buses moving minors across the country? Let's debate terminology. This is exactly why Americans don't trust this administration on the border. When you can't even say how many facilities you're operating or how many government-contracted nurses you've pulled out of hospitals during a pandemic, that's not compassion. That's chaos. And let's talk about the word games. The congressman says, illegal immigrant children. And suddenly the secretary wants to hold a seminar on asylum law. That's not an answer, that's a distraction. The reality is these children cross the border outside lawful entry processes. Whether they request asylum afterward doesn't erase the surge, the strain, or the cost. It just changes the label. And Democrats love labels more than solutions. Then comes Title 42. The administration is about to lift a policy that was helping control the surge. And when asked if the budget accounts for the flood that will follow, the answer is basically, we'll do the best we can. That's not a plan. That's hope mixed with paperwork. Meanwhile, buses are moving kids across the country. Facilities are expanding, contracts are ballooning, and no one seems able or willing to give concrete numbers. That's not transparency. That's institutional shrugging. The Republican congressman did exactly what oversight is supposed to look like. Direct, focused, relentless. He exposed a department that's reacting instead of leading and managing optics instead of managing the border. And the fact that the answers were so thin tells you everything you need to know about how prepared this administration really is.